Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you.
Hi folks, this is Dr. Virender Sodhi, and I'm today in Bend, Oregon from high desert and enjoying a little mini vacation with my family here. It's a beautiful setting. We are in almost nowhere in the jungle with a small cabin, and it's beautiful, and thanks to the technology, we can put our show from the remote corner in Bend, Oregon. And I'm very excited today about the topic of heart disease. And because, as you know, the heart disease is the number one killer of USA, not only USA, even India. And more than 600,000 people die every year with only heart disease. So in this radio show today on heart disease, I'm going to talk to you about sudden cardiac death, which is called heart attack, and why people die. And there is so many people die with sudden cardiac death, and it's a killer. And then there is a coronary artery disease, which is a disease of the blood vessels of the heart. So the heart has a blood supply of its own, and if something happens to that blood supply, you get a coronary artery disease. And then we will talk about what causes heart diseases and what you can do to prevent these heart diseases. Most of the heart disease is preventable, and there will be few people who will get some congenital defects, or people will have inherited defects. But most of the diseases, I will say up to 95 to 98%, are within our own control, and we are what get the diseases because what we are doing to our bodies are causing the diseases. And then we will also talk about why the Indians from India get more heart diseases, and in general, more immigrants from all over the world get more heart attacks. And so we will talk about that, what is the reason for that. And then, also very favorite topic about alcohol. And you all heard about French paradox. And the French paradox, and people always says, oh, wine is good for your heart. Yes, it is good for you, but how much is good for you? We'll also talk about that, that what is you can do to limit your alcohol so it does not affect your heart. And what kind of testing you need to do to see if you have a heart disease underlying in your body. And, you should not be surprised. I have so many stories to share with you today. And some of my favorite and close friends has died all of a sudden. And even in the medical field, they did not check for those clues. And I don't want that you should be one of those. And I'm going to give you those clues. Those are some of them are very simple tests which you can do to find out if you are a candidate for heart disease. And most of the Asians, the Indians, and even in general Americans, almost 43% people die with heart disease, and in Indians around 53%. So I think 1 out of 2 are having this disease. So we all have to be careful, and we all need to do everything to make sure that we are not a candidate or we are not having this disease which is silently causing this heart attack in you. So first of all, I'm going to talk to you about sudden cardiac death. So this is actually is the number one killer. When you get a sudden cardiac death, people die, and there is no second chance. So that's why I think every one of us should know about sudden cardiac death. And sudden cardiac death is not a heart attack. It is not due to the blood supply defect. But people who have a blood supply defect have sudden cardiac death too. So there is a difference here. So in sudden cardiac death, there is a difference between the electric communication of the heart. So the heart has a pump, and which needs the electric connection to pump, and that pump get offset. And when you have the offset of that pump, you are going to get a cardiac arrest or heart attack. So basically, the difference between the coronary artery disease and heart attack is The coronary artery disease is the blood supply of the heart, where the supply. There are three major vessels which supply to the heart, and one of them, especially the left anterior descending artery, which is the main jugular of the heart, which supplies the major supplies to the heart. If that get affected, you can get a sudden cardiac death too. You can die with that heart attack. And 50% people who get a heart attack for the first time will die with a heart attack. So it's very dangerous. So what we all need to understand that what we need to do to prevent this disease from not happening. So one of the things when people get a sudden cardiac death or you see somebody is having heart attack, you can help them to save their lives. So I believe every one of us should have a CPR training. It's simple, it's easy, it can be done, and you can save lives. If you start doing CPR immediately, as soon as somebody is down, and you check the vitals, you check for the if that person is breathing or not breathing, and you check the pulse if there is no pulse. So first thing what you need to do is call for help, like call 911, and because 911 is not going to be there with you. So as soon as you put responsibility of calling 911 on somebody else, or you can call yourself, as you're calling, you can start doing the chest compressions. And in today's world, there are a lot of stuff available on YouTube. You can go on YouTube and get a internet-based training on CPR. There are also CPR training available at fire stations, and there are also companies which offer CPR training. And I believe that every one of us should have that knowledge. I'm saying it again. Every one of us should have a CPR training because it saves lives. I remember back in India when I was a young physician, so many people died in front of our eyes because we did not know how to do CPR, and that was a shameful process. And I try to make myself, at peace with that because we were not given CPR trainings, and we people were not having that training. They can help people, but in my clinic, almost all staff is trained for CPR, and we every couple of years we refresh those to have the CPR training, and it's such an easy thing to do. And the latest on the CPR is you do compressions. You don't have to do the mouth-to-mouth breathing as long as you're doing chest compressions. And if you keep doing the chest compressions, the brain will get some circulation of the blood and will save people from getting brain dead, and it will help the heart attack too. And now, in many places, if you see at public places, at the airport, there is also defibrillators installed on those places, which can also help to get out of that. Yes, you can't reverse it immediately, but you can help. And the help, it will be provided by the experts, which will be the doctors. So, but your role is to provide the CPR, and if there is any defibrillator, you can use that one too. So, who is the candidate for sudden cardiac arrest or sudden cardiac death? So, anybody who has a heart attack in the past, there is a 75% sudden cardiac death happens to those people who has a heart attack. So, people who has a heart attack, that means the damage in the blood vessels has issue with the sudden cardiac death syndrome. Person after the first heart attack, for the first 6 months, they have a lot more chances of getting sudden cardiac death. 80% people who have sudden cardiac death has a coronary artery disease. As I said earlier, the coronary artery disease is where the blood is not supplying to the heart. And also, if you're a smoker, again, guys, smoking. If you're a smoker, you are going to have more sudden cardiac death. Blood pressure. If you have uncontrolled blood pressure, you will have more chances of getting sudden cardiac death. And these are all preventable. You can prevent smoking by not smoking. Just stop smoking. Hypertension, you can control by stress reduction. Interesting thing is, if you look at the definition of hypertension, it's called benign hypertension. Benign means there is nobody knows why you have blood pressure. And if you look at the primitive societies where people have these gadgets and cars and high-tech stuff, they have no high blood pressure disease. So this is the disease of a more of a advanced society. And in primitive societies where people lived in the villages, people lived in a kind of semi-urban states, they don't have heart disease and also doesn't have hypertension. Also, if you have a family history of heart disease, you have a chances of getting sudden cardiac death. And then again, the cholesterol story has been put in there, but I don't believe cholesterol is the only cause of sudden cardiac death. I did a program on cholesterol previously, and we talked about that a lot. What the cholesterol, how the cholesterol has been linked, although there has been no clear link established. So the other things which can cause a sudden cardiac death is if your heart is not pumping properly, so which we call ejection fraction. So what that means is when your heart is squeezing and relaxing. When it squeezes, it almost relaxes double the time to relax, and that is very important. And when it squeezes, it causes a certain pressure inside the heart, and that is called ejection fraction. And if your ejection fraction is less than 40%, you have more chances of getting heart attack. Again, the prior cardiac arrest you have, which we talked about already, if you have electrical issues, which is called tachycardia, or you have a arrhythmias where the heart is not regularly beating, sometimes congenital heart defects, blood vessel abnormalities. Some people they get syncopic attacks. Syncopic attacks are when you all of a sudden you drop down and then you regain your consciousness back again. And again, nobody knows why people get that. Certain people has a heart failure. What that means is the heart is not able to pump and it enlarges in size and manifold and it causes the problem. Some people has an enlarged heart as it is. So these are the main reason. But if you are also overweight, you're also causing sudden cardiac death. If you have a diabetes, you're also causing the sudden cardiac death chances more. If you have diabetes, your chances of getting heart attack increases fourfold. So what that means is that already there is 43% people dying with a heart attack, and when you have a diabetes, you have fourfold chances of getting heart attack. So all these things which you need to keep in mind, and a lot of these factors are under our own control. So now coming back to the what is the this coronary artery disease. So coronary artery disease is, which basically a lot of people think about heart disease is the blood vessel disease. So there are three main blood vessels which is supplying to the heart, and if one of them, two of them, or three of them get blocked, then you're not supplying to the heart. And heart is a pump and needs constant supply to the rest of the body. So when the main supplier of the supply does not get its own supply, it goes into a heart attack situation. So almost 370,000 people got heart disease, coronary heart disease last year, and they died with it. So, and this is with the coronary heart disease. So it's almost 60% of people with the total number of heart diseases will die with the coronary heart disease. And the main treatment for that, which we've been all told, is statin drugs to lower cholesterol. And in my previous radio show, we talked about that the cholesterol-lowering drug has shown no improvement in that one. Because if you look at the statistics, it does not catch up. There is not a real number lowering with the heart disease, coronary heart disease, especially with giving statin drugs for lowering cholesterol. And if you look at it, around $320 billion are spent on cardiovascular diseases and strokes. Stroke is another blood vessel disease, but it's happening in the brain. So same process which is happening in the heart, the blood vessels can get narrowed, and the same thing can happen in the brain, and it can rupture. Or sometimes you can also get with the weak blood vessels in the brain. So basically, I think what we need to do is we need to help this process. What we can do to help the whole heart to not to get into that disease stage, and what are those factors which we can do to help the whole process. So let's discuss what causes heart disease when we come back from this the ad here.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
So, if you look at the data from 2000 to 2010, there has been a decrease in the death from the heart disease, and because of the advanced technology we're using. So, we are able to fix heart more easily with stenting, which we call angioplasty, which we go in the heart, which the blood vessel is narrowed. We open that up by putting a spiral kind of a stent, which opens up, but that does not solve the problem, because what happens, you stop you actually temporarily you have opened the blood vessel, but the disease still exists. And also bypass surgery. So there is a death decrease due to heart attack, but the disease still stay the same. So I don't know if you understand what I mean here. So the number of patients which has disease still staying the same, but death due to the heart attack has decreased because we are doing this heroic procedures. I remember a patient who came to my clinic, and he had a heart attack, and he was sent to the hospital where he got stenting done, and next day he was out of the clinic, the hospital, and then he came to my clinic following day. Said, Dr. Sodhi, it is too scary to think that I fixed my heart disease. I said, you did not fix your heart disease. You just fixed temporarily. Because if you look at the stenting, the data shows that people who get stenting, they are ready for another stent within 6 months to 1 year. So that means, if you don't follow what you need to do, you are going to get your heart blocked again. So this is very important that, we needed to keep our heart healthy, and there should be a heart healthy diet. There should be a heart healthy hygiene. There should be heart healthy exercise programs. And unfortunately, we are not doing those programs, and we are not helping the whole process. So yes, with the advanced surgery procedures, and with the stenting and bypass, and maybe putting the valve, we are helping people, and also the electrical system. We are putting the electrical system is in the heart. This is helping people, so people are not dying due to the heart attack, but the number of the patient is the same or even growing more. So one of the things, I see a lot of Indian Asian patients in my clinic, and a lot of them has heart disease history, and either their father or mother or their grandfather has a heart attack. And this is also goes hand in gloves with the diabetes. So when you have more diabetes, as I said earlier, your chances of getting heart attack increases considerably. And most of these people, they are put on statin drugs and on anti-diabetic drugs to help the diabetes. But if you look at it, after year, they still get heart attack. I can see in my family, one of my family member who was on statin drugs and still got heart attack after being on that for almost 10 years. So, and did not provide that safety which was considered to be, there for with the statin drugs. And I see that in my patient. And then looking at the statistics, looking at the data for over the last 20 plus years, we don't see that statin drugs has provided that security, that safety net, which we think will be provided by it. So what you can do to help to lower your cholesterol. So as I said, cholesterol is not the problem. Lowering cholesterol is not going to fix your heart disease. The Framingham study, which was the basis for the whole lipid theory, where the statin drugs were thought that will prevent the heart disease, has not shown to help the process. And it actually has been cited wrongly and has given wrong information. The Dr. William Castelli, who actually is the former director of Framingham Heart Study, and he said in his editorial in 1992, published in the Archives of Internal Medicine, that people who took more fat and who has a higher cholesterol has actually least heart attack, and they were more physically active and more active, and their weight was less too. So I think there is something wrong with this whole theory which we have been given to it. And there is another very famous doctor, Dr. Stephen Sinatra. He's a board certified cardiologist, and he has said that, let's face it, cholesterol is something your body needs it. If you look at the study, multiple risk factor interventional trial, where they looked at 180,000 men over a period of 13 years, men with cholesterol of 330 had less hemorrhagic strokes than men with cholesterol than less than 180. Again, cholesterol we need for the body. Cholesterol is the basis for all the hormones in the body. Cholesterol helps to make your vitamin D3, and a lot of people nowadays are low in vitamin D, and we substitute vitamin D, which I'm not very satisfied that substituting vitamin D is the only option. So I recommend people to go out in the sun, spend some time, 20 to 30 minutes on the in the sun, so that they can manufacture some of their vitamin D. Again, all the hormones in the body is made from the cholesterol, and the LDL cholesterol, which has been blamed to be the bad guys, is the process how the fat is delivered to the cell. So how that can be bad? When that is the process how the fat is delivered to the body, how that can be bad? So basically, I think we have done the things wrongly, and we have created a hypothesis which does not hold up anymore. And so we have to think differently. We have to think out of the box that what we can do to help the whole process. And if you look at it statistically and evidence-based, this theory has not been working and is not going to work. The recent studies which have been published in people who took statin drugs for 5 years, they have 46% more diabetes. And diabetes is itself increases the chances of getting heart disease. So we are not fixing the problem, we are making it more worse. So basically, I will tell you what you need to do to help the whole process when we will come back from the break.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022.
So, one of the things which is very important in any health is your nutrition. And nutrition, I call them threefold nutrition. One is your oxygen. When you breathe in the air, you're getting around 21% oxygen. And it may sound funny to you that you only utilizes around 5 to 8% of oxygen. When you're breathing out, you're actually also breathing out 16 to 18% oxygen. And that when you breathe in the oxygen, you're making into a carbon dioxide. Carbon dioxide is not bad for us either. It is very relaxing, and it actually helps us to relax. So there is a homeostasis, there is a balance. And if you don't learn that balance of breathing properly, and unfortunately, most of us are breathing less than 20 to 30% of our capacity. So you can make your heart healthy just by breathing. Isn't that simple and crazier? You can breathe and can make your heart healthier. Basically, if you look at it, what your heart needs is oxygen. The coronary artery disease is because your heart is not getting enough oxygen. So just breathing will help that one. And then the food. And if you look at it, all around us in the mother nature, and this is the one interesting question which I put to my patients, do you see any hanging fryers on the trees? There are no fryers hanging on the trees. When you fry your food, you're making it rancid. And when the rancid food you eat, you are going to create a problem because the body is not designed to clean that off. And then looking at how much preservatives we have put in our diet, how much chemicals, how much pesticide, all are going to do some harm to us. So our diet has to be clean. And again, the American Diabetic Association, American Medical Association has not done good to us. In the last 30 some years, we have been told that fats are really bad for us. So what happened since 1980, since we start to keep the statistics on diabetes and other diseases, the diabetes right here in America has increased fourfold, and people have become more chubbier, more fatter, and more abdominal obesity, and more diabetes, and more heart disease, and more cancers, because we told people the fat, saturated fat, is bad for you. Actually, saturated fat is not bad for you. Again, excess of everything is bad. But if you eat saturated fat like ghee or butter or coconut oil in moderation, you are going to help your body to stay healthy. And interestingly, if you look at it, except from the heart attack, the number one killer is also smoking. Almost 435,000 people died in America in 2000 with just smoking. So who controls it? We control that. And I know it's addiction, and we all have addiction, and we have addictive patterns. But if you don't work on it, there is no quick fix which can help that process. So again, let's looking at stop smoking, and there are lots of helps available to help you to help the process of stop smoking. There is a wonderful acupuncture treatments available. There is also psychotherapy available. Even there is a drug treatment which can help you to stop smoking. But overall, you have to help yourself. If you don't want to help yourself, nobody can help you. Then the next one is vegetarian diet. By the way, guys, I didn't ask you to call. If you want to call me, the number is 1-844-301-1250. Again, the number is 844-301-1250. Again, third time, number is 1-844-301-1250. If you have any question, give me a call. I will be very happy to answer your questions or any doubts you have or any suggestion you want from me. So if you look at the vegetarian, not the Indian kind of vegetarian, the vegetarian people who ate more green fruits and vegetable, has less heart attacks, less heart diseases. The Indian vegetarians, they eat a lot more grains. So I have a new terminology for them. I call them grainarians because they eat too much grains, rice and rotis, which is made up of the doughs of the bread. And so what you're eating is you're overloading your system with a lot of carbohydrate. When you eat too much carbohydrate, your insulin is not becoming very sensitive. When insulin is not sensitive, it turns that into fat, which is your triglycerides and LDL. So what happened that excessive amount of fat, now body don't know what to do with it. It doesn't want to deposit in the blood vessel, so it starts throwing out, and you start depositing it around the waist, around back of your neck, in your hips, and that obesity is a killer, especially on the abdomen. And everybody who has the fatty abdomen, he has inflammation in his body. The abdominal fat is the sign of inflammation. So we need to be very, very careful about that, because once you have the abdominal fat, your chances of getting heart attack increases, your chances of getting diabetes increases, and also cancer increases. So I very heavily emphasize everybody to cut down the abdominal fat. And there is a test which we call BMI, which is your weight and height ratios. And anybody who has a 36 and high BMI are prone to diabetes and heart attack and cancers more. So basically, vegetarian diet, what will be that look like? Vegetarian diet which has lots of green vegetables. So I suggest that every one of my patients should have around 4 to 5 servings of green vegetables a day. And there are lots of books written on paleo diet and this diet and that diet, and then there was also South Beach diet, and the Dr. Atkins diet got very popular. But if you look at the Mother Nature, and if you want to be a hunter, and you go out to get an animal or bird, first you have to walk all day long to get a bird or animal. So you got a lot of exercise. And by the end of the day, if you got a bird or an animal, if you're lucky, then you have whole family to feed with it. So your chances of getting the main diet as a protein reduces drastically right there. So what you will do to survive on, you will be picking up some shrubs and some greens and some roots and some nuts and some seeds. So that is your diet, original diet. Yes, you ate animal protein here and there, but you did not heavily eat animal protein. And if you look at people who live longer around the world, in Hansa Valley or in Okinawa in Japan or Sardinia or other places, these people are basically mainly vegetarian and they're eating meat but very limited amount of meat. But majority of time they are vegetarian. And in India, basically, I remember our families did not eat a lot of meat. Coming to America, we are consuming meat now a couple of times a week. Back home, we were using only chicken maybe once a month, once a week, maybe once a month. And I grew up in the mountains of the Himalayas. They were not vegetarian. They will have a goat meat, but that was again every 3 months or 4 months, not every day. So I think we have done something wrong with the providing the animal protein too much. And again, these too much animal protein, and especially the farm-raised animal protein, like how our cows are raised, how our chickens are raised, and how the fish is farm-raised, we end up putting too much hormones in them, and to make them fattier and bulkier, and that is also going to do the same thing for our body. So whenever you're trying to eat these animal proteins, make sure those are organic and not farm raised. They are if they are farm raised, they should be free range chicken. And the fish you want to buy natural sources fish, wild caught fish like salmon. And there is a difference. Even the taste is different. I don't know if anyone have ever tasted wild salmon versus the fish, salmon fish from the farm. There's a huge difference in the taste, and there's a difference in their profile of the amino acids and the fats. Uh, so why we want to have a whole food vegetarian diet? Because you get all your vitamins, all your minerals, all the fiber, and all the essential fat from your vegetarian diet. So what vegetarian diet will include is like lots of green vegetables, couple of fruits a day, seasonal fruit. Mother Nature packs up all the vital nutrient for you uh, to help your whole body to the best, and that's what the animals do. And if the animals don't have a doctors to go and tell, give me a vitamin pill, I'm lacking vitamin, and but they do it by eating naturally what is available. There is a caller. Go ahead, please.
Hi, Dr. Sodhi. So I
Hello.
have a question.
Hi.
Hello.
Yes.
So I have a
Yes.
question. I had a relative who had a triple bypass, and what we have noticed is there is, I think, personality change. And why does that happen? He used to be very jovial, very happy person, but it's been, I think, over a year now. But we find that there's change in his not a very jovial person anymore. So why does that
Yeah.
happen, and how do we help him with that?
Yeah, so it's a very common process. What happens when people go under a sudden heart bypass surgeries or even stenting, they go into a depression. And so I think one thing is a fear factor that, oh my God, I have a heart attack, and they have a hard time accepting that. And so the best method for that is going eating the normal healthy diet which we're talking about, eating more vegetarian based diet. Fish is good for you. Eat more fruits and vegetables, nuts and seeds, doing yoga, doing pranayam, taking some herbs which will help to boost it up too, and also looking at the whole picture. There are a lot of tests which I'm going to tell people who are candidate for heart disease or who have a heart attack already, and they may not, their doctor may not ask for those tests. So I will also, tell you those things too. But basically, a lot of people who has a heart attack will go into depression, and they get into a like different mood. And so I think as a family, as a friend, we need to create some program. Say, okay, let's go for a walk. Let's do yoga. We'll do together. Let's go for a walk in the jungle. Let's go for a hiking trip. So all those small, simple things can help make a big difference in people's life. Uh, okay, so we're talking about the diet here, and so all the minerals and vitamins are supplied naturally by eating natural food. We may not have to depend on B vitamins and this vitamins and that vitamins because Mother Nature packs all these vitamins in its food, and these all vegetables are rich sources of vitamin C, E, beta carotene. We name it, we all have it. Magnesium, potassium, all those vitamin K. These are naturally occurring, and we don't have to depend. But most of us, we are eating so less fruits and vegetables that then we end up taking these vitamins. And the sad part of the story is that taking vitamins has not shown to improve the quality of life or heart attacks or diseases. So that is kind of goes against it. Then the fat. We have been told that the saturated fat, especially like a butter or ghee or coconut, has been bad for us. It's not true. I do believe that we should take some amount of good fat, saturated fat, like butter or ghee, or yogurt or full fat milk even, and coconut oil. But I don't only ask people to take these food. I also want to take different varieties of oils, like you can have olive oil, avocado oil, sesame oil, almond oil, grapeseed oil, different variety of oil. And these oils you don't want to fry, because when you fry, you are cooking your food at a very high temperature and you're making them worst. So very important that you put oil on top of food. And if you want to learn more about your cooking, you can go on our website, www.ayurvedicscience.com. And there's a one topic we talked about: is your food making you toxic? And we have talked about what you are doing wrong to make your food toxic. And so you can really look at that and learn some easy methods of cooking. So again, the other we talked about a lot of the fat, and another good fat is omega-3 oils. A lot of people talk about omega-3 oils. So fish provides the omega-3 oils and has a good protein too. So also, if you look at the studies, people who eat more fish has less heart attack and less even cancers. But people who are vegetarian says, okay, what is my source of omega-3? Yes, there are natural sources of omega-3. Walnuts, for example, has a good amount of omega-3. Flaxseed oil has omega-3. Flax seeds has omega-3. So these nuts and seeds are rich source of your omega-3. And chia seed, I call chia seed the fish of vegetarian because it has a lot more omega-3 than even a fish. So you can consume chia seed, or maybe 2 tablespoons a day, flax seed, even sesame seed, which is not a rich source of omega-3 but has other good fat in it. Walnuts, pecans, almonds, macadamia. You can consume almost 2 handful of nuts and seeds a day without causing any much problem. And a lot of time, I see patients, especially females, say, Dr. Sodhi, if I eat nuts and seeds, I'm going to get fatter. No, you're going to lose weight. You get fatter with the carbohydrate and sugar, which a lot of people love, and they don't want to stop that one. But if you take good amount of these fats, you actually are going to get more slimmer and more healthier. So basically, what we need to add here is the fiber, and fiber comes from fruits and vegetables and your greens and your grains, whole grains. White grains are not good, like white bread and white rice. Those are not good. And there are grains which has a lot more protein than other grains, like amaranth has a lot more protein than other grains. Quinoa has a good amount of protein. Then there are grains which are really good for blood sugar control, like buckwheat, brown rice versus white rice. So if you eat the grains in a whole form, like a steel cut oat, will be really good. But if you're diabetic or pre-diabetic, if you only use carbohydrate source, you will have more problem with it. So what you need to do is add fat and protein. So for fat and protein, what you can easily do is add nuts and seeds. Now you have a balanced formula. So if you have a 1 cup of oatmeal, you took half cup of nuts and seeds with it. Now your blood sugar will balance, your cholesterol will drop, it will not go up. So simple, very easy method of controlling your blood sugar and your fats. So again, if you look at the what causes these heart attacks, there's inflammation, and the inflammation is can be measured, and there is a special test which is called C-reactive protein. So if you measure that C-reactive protein, it can tell if you have an elevated number of it. The normal is less than 1. If you have 1 to 2, you have above average risk of getting heart attack, which is that means you more than 43%. If you have above 3, lot more, 2 to 3 fold chances of getting heart attack. And if you have above 10, that means there is some systemic inflammation in the body also, which needs to be focused. So this C-reactive protein test is a simple, easy method. It costs only $8 to $10 to do, and you can help the process by looking at that test and getting the things done, and then your doctor can, especially natural medicine doctor, can give you supplements to help. And one of my favorite for inflammation is the turmeric or curcuminoid. I have a preparation which I designed. It's called co-curcumin, and which has shown remarkable results in cutting down C-reactive protein many fold. So what kind of testing you can do to see if you are a candidate for heart attack? One of my favorite tests is called calcium scoring. Again, the test is called calcium scoring. This basically is a CAT scan of the heart, and you are measuring how much deposits of calcium are in your blood vessels, and their numbers are from 0 to thousands. So on this test, 0 score is the best one, because that means there's no deposit of calcium in your heart. And if you have above 200, then there is some chances of getting heart disease. 400, you certainly have a heart disease, although no test is 100% sure, but this will tell you. Again, the most common test is treadmill test, where you walk on a treadmill and you're hooked up to EKG, and which will tell you if you go under a stressful situation with the walking, and if there is EKG changes, that's considered a gold standard. But it is not a gold standard, because in females especially, 35% females, you will miss them having a heart attack or heart disease, because it's not going to tell the whole story. Even people who are very athletic or who are very exercise oriented, you will also miss those people, because they will pass that test with the flying colors. Then there is another test which you can do. It's called carotid intima thickness test. So this is an ultrasound which is done on the carotid arteries, and you see how thick your blood vessels walls are. I already talked about the C-reactive protein, which is a inflammation measurement in the blood. And then also there are cholesterol tests, but different kind of cholesterol tests. So traditionally what we do, we check for total cholesterol, we check for LDL, we check for VLDL, we check for HDL. So, but if you look at it, that does not tell us the whole story. If you do a special test of the lipoproteins, which is called the particle size, the more bigger molecule of LDL you have, the less problematic it is. If you have, suppose 130 or 155 LDL, then they are big molecules, you don't have a chances of getting heart attack, because the smaller molecules is what can stick to the blood vessels and cause a problem. So these tests are available, and you can ask your doctor to do the particle size. So the test name is called particle size on the lipids. And also on every patient I do a test called A1C. So this is the test which tells if you are going to be diabetic or pre-diabetic, or you have a frank diabetes. So remember, when you have diabetes, your chances of getting heart attack increases 4-fold, 2 to 4-fold. So when you measure this, you are also checking out if this person is going to have a heart disease or not. Then there is another test which is called stress echo. So this is done with a specific machine in a cardiologist's office. That's also very helpful to find out if you have any heart issues going on. And there are some genetic testing, which although it's not traditionally used, and one of them which I have seen in some people is called ApoE gene. That gene is shown to have problem with the saturated fat. So if you have ApoE gene and you eating like a butter and dairy and stuff, your chances of getting heart attack increases many fold. But this is not a very common kind of gene. So I don't think we all have to worry. But if people have issues by eating fat and they get more fatter, it can be checked in those people, and you can find out that if this is the cause of your problem there. So these are simple tests which you can do. Again, the test, it can be calcium scoring. You can check the ultrasound of the carotid arteries. You can check C-reactive protein. You can do a particle size of the cholesterol. You can do A1C, stress EKG, and the genetic testing. And of course, liver enzymes, and because you're looking at the overall picture. And sometimes also looking at the nutrition values of the whole person, how much vitamin D is there is very important. And how about B12, folic acid, especially for vegetarians. And there is also a specific test available which is called nutrition evaluation test, where you're checking how you are absorbing your nutrients and how much your B vitamins are and other vitamins are showing up in the system. And that can be helpful guidelines for us to help make a program for people. Okay, so let's take a short break here, and then when we come back, we'll talk about how about the alcohol. Is that alcohol is really good for all of us, or some of us can have it, or some of us cannot have it at all?
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
So, we all have heard that wine is really good for your heart. And the French people drink lots of wine and they have a less heart attack. Yes, that's true. French people drink wine and they have less heart attack. But have you ever seen how much food they eat? So in America, we are overdosed with everything. We're eating the size of our coffee cups as compared to the French is, I think, maybe 20-fold more increased. Our size of the bread is a lot more fatter and bigger. Our servings are a lot more bigger. So one of the interesting things which French people do, they eat less and they eat a lot of seasonal fruits and vegetables. So we can only say, okay, French people drink wine, then they have less heart attack. And it has never been proven. It was a good advertisement for them to promote their wine. And the alcohol, one glass of wine, one beer is okay for a male. And it does have some protective action on the heart. It does increase your good cholesterol, which is called HDL. But if you're drinking 2 or 3 drinks a week, you can increase your chances of getting more heart attack because it becomes cardiotoxic. And unfortunately for females, it is not advisable to drink wine or alcohol because the chances of getting breast cancer increases manifold. So looking at this whole data, which is available now, and in dissecting it, it seems like the alcohol in moderation, okay for male, for female may not. Ceremonial here and there, perfectly okay. But in general, you should avoid the alcohol. Okay, so one of the other questions which people ask me, Dr. Sodhi, why Indian who have come to this country has more heart attacks? In general, if you look at it, all the immigrants which has come from different countries has more heart attacks, more diabetes, because of the stress factor. When you move to a new country, you have a lot more stress. There's adaptation. You're trying to understand the language. You're trying to adapt to the food. You're trying to adapt to the festivals. You're trying to adapt to the surroundings, your neighbors, and everything is changing. And that is stressful for humans. It's like, if you take an animal from the wild and put them in captivity, and that animal will not survive. So exactly the same thing happens. So it's mainly the stress factor. And then on top of that, what happens, our nutrition habits changes, work ethics changes, and you are getting less sleep. I see a lot of these IT guys who have come from India and very young people, 30, 35 years old, and have a high cholesterol, testosterone bottom line. Another interesting factor is people who has a low testosterone will have more heart attacks. If you have high amounts of testosterone, normal testosterone in your body, you burn off your calories are burned off more easily, and you're not going to have problem with extra weight. So normal amount of testosterone is very healthy for heart disease because it will prevent the heart disease. And similarly, we have seen in females when the hormone drops, they get more heart attack. A lot more heart attack happen in females after the age 50 because what's going on is the hormone are dropped. Although giving hormones has not shown to be very protective, but you can do exercise, you can do yoga, meditation, eating healthy diet will help that process too. So basically, it all boils back down to eating healthy food, healthy exercise, yoga, breathing exercises. And there are lots of different hurdles which you can take too. And I'm not the greatest fan putting people on vitamins and multiple different kind of vitamins. I believe you get it from Mother Nature, and most of them you can get from the fruits and vegetables, except for vitamin D, because we are not, and especially living in the Northwest and here, we are not going to manufacture enough. Although I'm not very convinced that that's the only source, so I still encourage people to go outside in the sun, spend around 20 to 30 minutes in the sun, so that they can manufacture some form of vitamin D in their body, which is the best form. And I've tested around 5,000 plus patients in my clinic with vitamin D, and all of them were low except for 3 patients. 2 were postal worker who were walking outside, and 1 was a lady from Hawaii, and her vitamin D was normal, and she was not taking vitamin D. So except for these 3 people, all of them has a low vitamin D. So I think the sun exposure, and these 2 postal workers, they were from Seattle area, so it's not they were living in Hawaii. And so basically, again, I think exposure to sunlight is very important. Around Northwest, we get the most better UVB sun rays from 10 to 2. So there are different kind of UV light, which is very helpful for us for promoting and making our own vitamin D. And one of them is called UVB, and which is more available for us between 10 to 2. And so spending some time in the sun in that time period will help to make your own vitamin D. So as the time is passing by, I think I'm going to just say it again, that you can prevent your heart disease. What you need to do is first you make sure that you're not a candidate by doing this testing, and you can do calcium scoring testing, you can check your carotid artery, you can do C-reactive protein. There's another test which we also add called homocysteine. You can also look at the lipid profile, looking at the particle size of the cholesterol, A1C. You can check your liver function, kidney function. You can also do the genetic testing. You can also do the nutrient testing to see if you're deficient in nutrient. And so that will tell you if you have a strong family history of heart disease, you should all do this testing. If you think you are a candidate for heart disease, you should all do that testing too. And so once you have established those tests, and then your doctor can help you figure out a plan for you. And what the plan should be look like: eat lots of fruits and vegetables. The more you get, the more better it is. I encourage to eat around 4 to 5 servings of green vegetables, 2 fruit servings a day, nuts and seeds up to 2 handful a day. Good fat, like saturated fat, ghee, coconut oil is good, 1 to 2 tablespoons a day, and another 1 to 2 tablespoons of another oil like olive oil or avocado oil or coconut oil type of stuff. And then do your exercise, do your yoga, do your stress reduction, meditation, spend quality time with your family. Is very important. We are stressed out beings here. If we are stress free, we are going to live healthier and happier. So with this, I think the time is running out, and I'm going to be next program we will do on hypertension, and because hypertension is again the major problem. 1 in 3 people has high blood pressure in this country, and we will tell you what you can do to help control your blood pressure normally and help your process of staying healthy. And the health is not a destination. So a lot of us, we do things for some time and then we'll get off of that program. So stay on your program. It's like a road. You walk on a road, then you're on a road. If you're off the road, you're not on a road. So stay healthy, live happier, and we'll talk to you next week again. Have a wonderful day.